सभी को मेरा नमस्कार। आज आयुर्वेद दिवस 8वें आयुर्वेद दिवस के उपलक्ष्य में प्रत्येक शुक्रवार की तरह आज शुक्रवार को हम एक नए व्याख्यान को लेकर आप सभी के सामने उपस्थित हुए हैं और मैं सभी पार्टिसिपेंट्स का और आज के स्पीकर का विशेष धन्यवाद करती हूँ यहाँ आने के लिए, ज्वाइन करने के लिए, इस ज्ञान यज्ञ को अनवरत शुरू रखने के लिए। और आज के स्पीकर अपर्णा जी का मैं विशेष धन्यवाद करती हूँ क्योंकि आज किसी अन्य स्पीकर का लेक्चर था, डॉक्टर पंकज जी, मगर उनको कुछ व्यस्तता रही जिनके कारण उन्होंने ही हमें डॉक्टर अपर्णा जी से मिलवाया और आज का लेक्चर आपने तुरंत ही हामी भरी विदिन 4-5 डेज। तो मैं आपका बहुत बहुत तहे दिल से हार्दिक धन्यवाद करती हूँ और आज के आयुर्वेद दिवस की शुभकामना। हम समझते हैं कि नेशनल आयुर्वेदा डे एक दिवस इंटरनेशनल आयुर्वेदा डे योग दिवस की तरह ही मनाया जाएगा और आयुर्वेद के अनेक अमूल्य सिद्धांतों से अनेक मानव जन उससे लाभान्वित होंगे। तो आज के व्याख्यान की शुरुआत करने से पहले मैं आज के स्पीकर का आप सभी के सामने परिचय रखना चाहूंगी। आज का अपने स्पीकर का नाम है डॉक्टर अपर्णा उन्नी जी, असिस्टेंट प्रोफेसर JSS आयुर्वेदा मेडिकल कॉलेज मैसूर कर्नाटका से आप बिलोंग करते हैं। आपने अपनी अंडर ग्रेजुएशन की पढ़ाई और पोस्ट ग्रेजुएशन की पढ़ाई दोनों ही JSS आयुर्वेदा मेडिकल कॉलेज मैसूर कर्नाटका से आपने पूरी की है। आपने अपना PG रोग निदान एवं विकृति विज्ञान में पूर्ण किया है और आज के व्याख्यान के लिए मैं आपको सादर आमंत्रित करती हूँ। और कोई सत्कार्य को जल्दी से हामी भर के उस कार्य में जुड़ जाना, ये बहुत बड़ी आपकी क्वालिटी है, गुणवत्ता है। तो ऐसी गुणवत्ता होने से मैं समझती हूँ कि आज 424वें लेक्चर में हम आप सभी के सामने इस ज्ञान यज्ञ में एक विशेष आहुति लेकर, जैसे कि इस प्लेटफॉर्म का एक उद्देश्य है कि अनेक श्रेष्ठ वैद्यों को निर्माण करना जो भारतवर्ष के अनेक लोगों की स्वास्थ्य संरक्षण में और स्वास्थ्य होने में उनकी मदद कर सके। बहुत बहुत धन्यवाद डॉक्टर अपर्णा जी। मैं आज के लेक्चर के लिए आपको आमंत्रित करती हूँ। ओवर टू यू डॉक्टर अपर्णा जी।
धन्यवाद मैडम। सभी को आयुर्वेद दिवस की बहुत बहुत शुभकामनाएं। It is my proud privilege that I am presenting myself in front of all of you on this auspicious day, in this occasion where we can share some knowledge. So we shall quickly begin with the presentation. My topic is Kamala. The references we find it in almost all the classics like Charaka Chikitsa Sthana, Sushruta Uttara Tantra, etc. We have a lot of references regarding Kamala. So quickly moving on. Madam, my slides are changing.
No, at present first slide is showing Kamala with reference to Srut, Charak, etc. Yes.
Yeah. So beginning with the introduction to Kamala. Kamala is one disease which usually is considered to be one among the liver disorders explained by our acharyas. It is going to affect the liver. So we usually consider that to be jaundice in terms of modern medicines because this resembles lots of signs and symptoms in a similar way. And why Kamala? Kamala is something which we find in every part of India because certain diseases are more prevalent in the coastal places, certain in desert lands, etc. But coming to jaundice, in India it is reported that 1,361 people in 1 lakh population is suffering from jaundice. And most of the time, the causative factors are substandard hygienic conditions, imbalanced nutrition, and excessive alcohol intake, which is provoking the disease by weakening the liver. So, Kamala is coming under Pitta Nanatmaja Vyadhi and Rakta Pradoshaja Vyadhi. So, now, why is it classified there? Because, as we all know, Pitta Nanatmaja Vyadhi, yes, because it is a Pitta predominant disease, and Rakta Pradoshaja Vyadhi, once again, because Rakta and Pitta, Rashra and Ashrayi Bhava, that is the Vriddhi and Kshaya of each other will definitely are dependent on these two itself. So here what is happening, Rakta Dhatu Dushti is affecting the Rakta Srotas, which is ultimately leading to the Moolasthana, that is the Yakrit and Pliha. For practice, this is what a point of view we usually have to refer. Why is it classified under Rakta Pradoshaja Vikara? Because until the Moolasthana, this is going to be affected. Next is some classical references which we need for practice as well as for our exams. We'll just have a note. The Nirukti of Kamala, that is Kama plus La, that is the patient always says there's absence of desire for food. Patient always feels there is no need of having food or the consumption of food is very, very less. And sometimes the same thing is considered as Panduroga, that is the next stage of Panduroga or the Upadrava of Panduroga is also Kamala. We have plenty paryayas like Harita, Harima, Haridraka, Vilohitatva, Panaki, Lagharaka and Alasa. Most of the synonyms here tells us about the yellowish discoloration predominantly. Coming to the most important part in practice, what is the Nidana? Pandurogi to yo atyartham, Pittalani nishevate. A person who's already suffering from Pandu, once again indulging in Pittala Ahara Vihara is ending up in Pandu. Sarva Pandu Rogotpadaka Nidana. That is anything which is going to cause Pandu, all of those can also serve as Nidana for Kamala. Pandu Rogavasthayam Kamala Mahaha. Once again, it is the reference with regarding to Pandu. There is one reference where they say, even without Panduroga, Kamala can arise, and that is by the indulgence of Pitta Prakopakara Ahara and Vihara. That we call as Swatantra Kamala. Because here once again, this Pitta which is undergoing Prakopa is going to do the Dushana of Rakta. Thereby, once again, it is going to affect the Yakrit and Pliha. There we are ending up with Kamala. That is Swatantra Kamala. Next is the exact concept of Kamala. What is happening in Kamala and the types of Kamala. First is increase of Pitta. That is especially Ranjaka Pitta. And here I've made it into a single slide because this is what is going to be your main theme when it's coming to your practice. So here types of Kamala is Poshta Shakashrita Kamala and Shakashrita Kamala. When a patient is coming to you, you should be able to know what type of Kamala they are suffering from because accordingly we can treat them. So here increase of Ranjaka Pitta is leading to both of them. But here what is happening? It is entering the Koshta or the Mahasrotas, also Rakta, Mamsatva, etc. Everything. Then it is Poshta Shakashrita Kamala, which is hemolytic jaundice, which is also considered to be pre-hepatic jaundice. One more thing is Shakhashrita Kamala, where Rakta, Mamsa, Tvacha, etc. are involved. Here that is obstructive jaundice, which is hepatic jaundice and post-hepatic jaundice. We stage this like this. So here, Bahupitta Kamala, that is when the patient is suffering from Panduroga, is involved, indulging in all these things, then this Bahupitta Kamala is going to happen. Here the vitiated Pitta is vitiating the Rakta Dhatu further. And again, as I told you, the Rakta and Pitta, because they have similar qualities, this Kamala is caused. Then, increased levels of Ranjaka Pitta is again seen in Koshta as well as in Shaka. The same explanation what I've told you. Here, all these things are happening. Later, what about Koshta Shakashrita Kamala? I told you, it has one more name which is Ubhayashrita Kamala. The symptoms of that is correlated to, as I told you, pre-hepatic jaundice. And that is because of the similarity between pathogenesis and symptoms. Because when patient is coming to us, sometimes they may tell us that I have jaundice. They may not tell us that is Kamala. So we need to correlate that clinically by the symptoms that they are telling. So once again, along with the lab reports, the pathogenesis also is something which we need to know. Excessive amount of bilirubin in the duodenum, that is considered to be Bahupitta. Increase in Pitta here can be considered to be bilirubin in the duodenum, leads to the increased urobilinogen in urine. That is causing dark yellow urination. I have put the symptoms what we tell here. You can have a look at it because how do we differentiate? So here again dark yellow urine, and then that is leading to urobilinogen in urine. Once again dark urine. One more thing what we say is dark yellow stools. Dark yellow stools is caused by stercobilinogen. Then again, because why? Ranjaka Pitta is responsible for Malaranjana. So more amount of Ranjaka Pitta and Koshta, more darker the stool is going to be. And that is why we consider this. And there is Rakta Kshaya, Daurvalya is seen in the patient because once again the Rakta is also affected. So differentiating characteristics of Kamala again classically, as I told you previously, Bahupitta Kamala and Alpapitta Kamala. Bahupitta Kamala where it is highly vitiated, Paratantra Kamala, the Shakashita Kamala is Swatantra Kamala. Again, Post Shakashita Kamala, the varchas is going to be Bhekavarna. Shakashita Kamala, Tilapishtaniba varchas, that is clay white stools. Just like the paste of Tila. And Shakashita Kamala is Ruddhapata Kamala, which once again we term it as obstructive jaundice. Post Shakashita, as I told you, it is Ubhayashita Kamala. We'll go in detail about all these things. Post Shakashita Kamala, how is it happening? Pandurogi, there a pre-existing Panduroga is there, who is again indulging in Pittaja Ahara Vihara. For them, Pitta, Rakta and Mamsa, these are going to be affected, and then the symptoms like Haridra Netra, Haridra Twak, Haridra Nakha, Haridra Anana, Rakta Pita Shakran Mutro, Bhekavarno, Hatendriyaha, Daha, Avipaka Daurvalya, Sadana, Aruchikarshitaha, Kamala, Bahupittaisha, Poshtashakashraya Mata. As I told you, the urobilinogen, the stercobilinogen, all the concepts come under this Poshtashakashrita Kamala, where the Pitta, Rakta and Mamsa are severely involved. The Nidana is once again Panduroga, Madhyapana, Amla Ahara, Pitta Vridhikara, Ahara and Vihara. So here, going for the Samprapti, patient who is already suffering from Panduroga, indulges in all these things, Ranjaka Pitta is affected. This Ranjaka Pitta is going to do the Dhagda of Asrak and Mamsa. Again, Panduvadana, all the Lakshanas, what is explained? That is explained in another slide separately. This is the concept which you must know in detail. Coming to the Shakashrita Kamala is Swatantra Kamala. So here, the word Shakha refers to Rakta, Mamsa and Twak, etc. Here, the patient need not be a Pandurogi all the time. Here, the Nidanas are, it is explained point-wise here. Tilapishtanibham yastu varchah srijati Kamali. The main classical feature of Shakashrita Kamala is their varchas is going to be that of Tilapishta, which resembles Tilapishta. Then, Shleshmana Ruddhamargam tat Pittam Kapaharair Jayet. Shleshma as well as Pitta are going to be affected here. Shleshma is the one which is going to obstruct the path of Pitta. So here is Ruksha Shita Guru Swadu Vyayamair Vega Nigrahaihi. So these are the Nidanas which is going to affect the people, because of which they are ending up with Kamala. Kapha Sammurchito Vayu Sthanat Pittam Kshipet Bali. This is the Samprapti that they are telling, which I will explain. Haridra Netra Mutratwak, from here it is the Lakshana. Shweta Varchas Tadanaraha. So Haridra Netra Mutra is similar, but coming to the color of Varchas, there it was Bahupita Varna or Haridra Varna, here it is Shweta Varna. Along with that, here there is Atopa, Vishtamba, Hridaya Gurutva, then Daurvalya, Alpatni, Parshvarti, Hikka, Shwasa, Aruchi, Chwara. All these things are going to happen in Shakashrita Kamala. This, as I explained in the shloka, I have just put a slide. Samprapti, what is happening after Nidana Sevana? Vata is vitiated there because of the Nidanas, which is getting mixed up with Kapha dosha. This Kapha dosha is acting as an obstruction, which is throwing Pitta out of its own seat. This Pitta is referred to Ranjaka Pitta. So Sthanat Pittam, whatever they told, that is Pitta Sthana from Yakrit. This is going to be obstructed. This enters the Rakta, Mamsa, Tvacha, etc. So here there is a special note. See, the Ranjaka Pitta is raised in Rakta, Mamsa, etc. That is, it gets accumulated in the Shakha. Hence, it is called Shakashrita Kamala. And since there is no Pandu Roga involved here, we consider it to be Swatantra Kamala. These are the Lakshanas as I explained in the shloka. Samprapti Ghataka. You would be studying it in your classes for the exam purpose, but you should know it more practically. So I'll be dealing with that now. Kumbha Kamala. Kumbha Kamala is once again an Upadrava of Kamala. Here the name is because of the Lakshana, what we are seeing here. As per Charaka Sutra, this is what Kumbha means. That is Drida Avayavo Alpamukho Gatakalashaha, which resembles like a Ghata. That is what we consider to be Kumbha Kamala, which is the very severe stage of Kamala, where the patient is ended up in complications. And what is the Lakshana? Asyam cha shoto api lakshanam bhavati. The main thing what we see is show of in hand, face and foot. The patient presents with swelling in all these parts. That is how we'll know that is the severity of Kamala has increased and ended up in Kumbha Kamala. Kalantarat Kharibhuta Krichrasyat Kumbha Kamala Krishna Pita Shakran Mutro Brisham Shunascha Manavaha. That is, once a patient is affected with Kamala, again after it has been untreated or the patient is not following proper Pathya and Apathya, that could lead to a complicated state which is considered to be Kumbha Kamala. Again there what are the main Lakshanas? Krishna Pita Shakran Mutra. That is, the color of the Shakrat is going to be changed to Krishna, Pita Varna and Mutra as well. Then Shuna, that is once again complete swelling of the body is seen. Sa Rakta Akshi Mukha Chardi Vinmutro Yascha Tamyati Daha Aruchi Trisha Anaha Tandra Moha Samanditaha. Once again, the color of the eyes and face, urine, stools, as well as the vomitus is all turning to the reddish in color here from the yellowish one. That means the patient has ended up in a complicated phase. Along with that, they have other symptoms like Daha, Aruchi, Trishna, Anaha, Tandra, Moha. Along with that, Nashtagni. Patient doesn't feel much appetite or patient is not feeling hungry. This is what is considered to be Kumbha Kamala. Acharya Chakrapani has told, Kharibhute iti kathoratam upagata Kumbha Kamaleti avastha bhedena Koshtagata Kamalayaha sanya Kumbha Koshtaha tadashraya Kamala Kumbha Kamala. Again, here the Koshta is involved here, and as per the time, once it is left for a longer duration, the patient is reaching this complicated phase. Lakshana, as I told you in the previous shloka, this is Kumbha Kamala. Next is a condition which is termed Halimaka. Halimaka is considered to be a Mahavyadi. That is a very, very serious, dreadful disease. How? Yadatu Pandor Varnasyat Harita Shyama Pitakaha Bala Utsaha Kshayaha Tandra Mandagnitvam Mrudujvaraha Strishu Aharsho Angamardascha Shwasa Trishna Aruchi Brahmaha Halimakam Tadatasya Vidyat Anila Pittataha. This is a condition of Halimaka where Pandurogi is again suffering from all these things, and these are the signs and symptoms. Harita Shyava Pitaka, the complexion is green, black and yellow complexion of the body. Bala Utsaha Hani, loss of strength and energy. Tandra or drowsiness. Mandagnitvam, loss of digestion. Mrudujvara, low grade fever. Strishu Aharsha, loss of sexual desire. Angamarda, body ache. Shwasa, breathlessness. Trishna, thirst. Aruchi, anorexia. And Brahma, vertigo. This is about Halimaka. One more thing we need to know here is Lagharaka or Alasaka or Panaki. Acharya Sushruta has mainly told about Lagharaka, that is, it is considered to be the next stage of Halimaka, and the Lakshanas are Jwara, Angamarda, Brahma, Daha, Tandra and Kshaya. So Acharya Sushruta has always referred this Lagharaka, and this is once again another serious complication of Halimaka. Next is Panaki. Panaki, Santapo, Binnavarchastvam, Bahirantascha Pitata, Panduta, Netra, Panaki, Lakshanam Bhavet. Acharya Madhavakara has told us that is patient presents with Santapa, fever, Bhinnavarchas, loose stools, Bahirantascha Pitata. The patient is completely turning into yellow. Panduta Netra. There is whitish discoloration of the eyes. These are the symptoms of Panaki. Coming to Kamala Upadrava. it is as same as that of Pandu. Which are those? Aruchi, Pipasa, Chardi, Jwara, Murdharuja, Agnisada, Shofa. Then Kanthagato, Abalatvam, Murcha, Klama, Hridayava, Pidana. That is the complications which are arising in Pandu. They are the ones which we find here also. Patient feels tastelessness, excessive thirst, vomiting, fever, headache, loss of appetite, edema, weakness, fatigue, all these things, whatever we find in Pandu, we find it in Kamala as well. This is in set of when we talk about one set of Kamala. Both the types we have classified, and we have come to know about the complications of Kamala. Next is the Sadhya Sadhyata of Kamala. Patient, the prognosis of Kamala. Krishna Pita Shakran Mutro Bhrisham Shunascha Manavaha Sa Raktakshi Mukha Chardi Vinmutro Yascha Tamyati Daha Aruchi Trit Anaha Tandra Moha Samanvitaha Nashtagni Sanyam Kshipram Hi Kamalavan Vipadyate. So here they are telling all these symptoms. When every symptom of this is present in a patient who is suffering from Kamala, we can predict that the patient is going to lose his life quite soon, because this is what we are supposed to check for the features in Kamala. When these things get severe, when all these symptoms are seen in the patient, then there is a chance of immediate death. This is Kamala. Now coming to modern, when we think of practice or when we think of becoming clinicians, what is something which is important along with knowing all these symptoms? Till now, I just went with all the classical references and the shlokas which you have already known, but this is the basic gist which we are supposed to know. Along with this, in today's parameters, when we are practicing, the laboratory investigations also play a very important role when it comes to the disease Kamala. Why? As soon as a patient tells us such signs and symptoms of yellowish discoloration, loss of appetite, fever, all these things associated, first we always ask them to get a blood investigation done. So that is why laboratory investigations are very important. So here we can go with a set of investigations which I will be telling you now. That is liver function test, where what is happening? Serum
connection you.
Dhatu, when there is Dhatu Agni Mandya, the Sara and Malabaga is also affected. So here, this serum bilirubin is taken. We can consider serum bilirubin to be Malarupi Pitta, which is found more in conditions of hemolytic jaundice. Because there what is happening? Rakta Dhatu is affected. Hemolytic jaundice, Rakta Dhatu is affected. So for Bahupitta Kamala, we can consider this. Okay. Then coming to another test, that is AST or SGOT. We call it aspartate aminotransferase, and ALT and SGPT, that is alanine aminotransferase. They are sensitive indicators of liver cell injury. So here, what we say, ALT is more specific measure for liver injury. That is, especially when it comes to alcoholic people. We call it ethanol-induced liver injury. So there what happens, this is always on the higher level. One more thing is, AST is always more than ALT in alcoholics. This you should know. AST is always more than ALT in alcoholics because ethanol sensitivities. So, how can we consider this now? Both these ALT and ALT and AST, as per various articles cited by many scholars, we can always consider that as Tejo Mahabhuta Pradhana entities. They are predominant of Tejo Mahabhuta. So there, what is happening when they are hampered once again? Agni Dushti is happening. When Tejo Mahabhuta, that is Agni Dushti is happening, we always know Agni Kshaya leads to Pitta Vriddhi. So we can correlate that as well. Here also, the ALT and AST, we can consider to have an involvement with Pitta. Next, alkaline phosphatase is a sensitive indicator of cholestasis biliary obstruction and liver infiltration. That is, these two things are other liver disorders, lot of other forms of liver disorders where these things are happening. So, Shakhashrita Kamala or Alpapitta Kamala tells us about the raised values of SGOT and SGPT. And the same person, if you ask about their stool, they will say it is Tilapishta Sannidha. Okay, so this is how we can differentiate the lab investigations. Once again, I put out liver function test in that serum bilirubin amount is raised in Koshta Shakhashrita Kamala. So here serum bilirubin is considered as Malarupi Pitta, and Malarupi Pitta or increased serum bilirubin, we find it in hemolytic jaundice where the Rakta Dhatu is damaged in excess. So it is Bahupitta Kamala. Coming to AST and ALT, they are more specific to liver injury. So in alcoholics, this ALT and AST are very important enzymes, and both of these can be considered to be Tejo Mahabhuta Pradhana. Here what is happening? When these increases, Agni Dushti is happening, leading to Pitta Vriddhi, thereby causing other diseases. So the raised value tells us this could be Shakhashrita Kamala or Alpapitta Kamala. Once again, for confirmation, we need to ask them the color of the stools and they will say it is Tilapishta Sannibha. This is about
दक्षा स्लाइड्स मूव नहीं कर रही है
जी, एक मिनट.
हाँ, साध्यता 34 समथिंग स्लाइड चल रही है.
हाँ हाँ, वो 34 के बाद दिखा नहीं रहा है मैडम स्लाइड.
नहीं,
30 में सीधा चिकित्सा सूत्र आ गया है.
हाँ जी, हाँ जी
जी जी, देखती हूँ. हाँ, नेक्स्ट चिकित्सा सूत्र आके
जी.
So after the lab investigations, next we need to plan for the treatment. So coming to the treatment of Kamala Chikitsa Sutra, Acharya Charaka has explained it in Panduroga Adhyaya, that is for Koshtashrita Kamala, what has to be done. Samshodhyo mrudubhistiktaihi kamalitu virechanaihi. So for Koshtashrita Kamala, Shodhana is the line of treatment, and that especially only Mrudu Shodhana. Mrudu Shodhana with Piktarasa Pradhana Dravya is going to help a person who is suffering from Koshtashrita Kamala. And why is it? In Bahupitta Kamala, there is a greater amount of Dosha Sanchaya and Dosha Dushti in the Koshta itself. That is why the main aim of the Vaidya is to remove the vitiated dosha out of the body, because all the dosha is in the Koshta itself now. So removing that is important for us, but at the same time, the Rakta and Mamsa also need to be protected here, because Rakta and Mamsa is also undergoing Dushti, but that has to be protected and the Shodhana has to be done. That is the reason Mrudu Shodhana is told. Mrudu Shodhana. And for that, Snehana with Mahatiktaka or Panchakavya or Kalyanaka is told in the classics. And Mrudu Virechana by Tiktaka Dravyas. So here I can tell you another thing, that is Aragvada, Trivrit, Draksha, all these act as Mrudu Shodhaka. They are not very severely affecting. And why Tiktarasa? Because they are Pitta Shamaka. That is why we consider Tiktarasa Pradhana Dravyas for doing the treatment. And one more thing is, when we are treating Kamala, we need to take care of two things. That is, one, Pitta Shamana has to happen. Along with that, the Pandu also should not increase. The patient should not suffer from Pandu further. That is the reason we need to think of this treatment accordingly. That is why Snehana is given with very mild snehas like Panchagavya Grita, Mahatiktaka Grita, Kalyanaka Grita, a few more I can tell like Dadimadi Grita or Indukanta. Because these gritas, why are these gritas mainly preferred? Most of the ingredients are Tiktarasa Pradhana Dravyas in this, and that is why they are Pitta Shamaka. Then we are planning for Shodhana, Mridu Shodhana. After that, we can put them on Shamana Aushadhis. Most of the time, we practice here with Ekamulika like Katuki, Bhrangaraja, or Bhumi Amalaki. The Swarasa is instilled to the parents. That will help them with the disease. Along with that, we'll give them compound formulations like Arogyavardhini Vati 250 mg thrice a day after food, Punarnavadi Mandura 125 mg thrice a day after food, and Palatrikadi Kwata or Triphala Kashaya 20 ml. Once again, this has to be given before food. We'll discuss medicines in detail. That is, one major thing we need to know here is Shodhana is the first line of treatment when it comes to Koshtashrita Kamala. Then all these Shamana Aushadhis we can give. Along with that, we can give them Kumariyasava, Ushirasava, Chandanasava. All these 20 ml after food. Kumariyasava, Chandanasava. These are the main things. Coming to Shakhashrita Kamala. Here what is happening, Acharya Charaka has explained measures to bring doshas from Shakha to Koshta. Here we don't find the reference exactly in the Chikitsa Sthana, but we can consider the reference of Sutra Sthana. Vridhya Vishyandanat Pakat, Srotomukha Vishodanat, Shakha Muktva Mala Koshtam, Yanti Vayoscha Nigrahat. That is, anything which is undergoing Vridhi and anything that is in the Shakha of the body, our duty first is to bring them back to the Koshta, after which we can eliminate it. Once the doshas which are undergoing Dushana is situated in the Shakha, it is difficult for us to eliminate it from the body. So the first aim of treatment is Vridhya Vishyandanat Pakat Srotomukha Vishodanat. Once again, clearing all the passages, all which is undergoing Vridhi, all those things are supposed to enter the Koshta first and then it has to be eliminated. So here we usually don't advise Virechana. This is the important point. For every Kamala, we can't think of Virechana. If it is Shakhashrita Kamala, our first intention should be bringing the doshas back to the Koshta and later we can adopt Koshtashrita Kamala line of Chikitsa. Whatever we discussed previously, the same thing can be done later, but once the things in the Shakha is coming back to the Koshta, later these things can be done. So, summarizing the Chikitsa of Alpapitta Kamala, here what is happening? First, Sthanika dosha. First you should differentiate whether it is a Sthanika dosha or an Agantuja dosha. After that, the stronger has to be treated first. That is Sthanika dosha. Anything which is present, whether it is the thing that is in the Shaka that is troubling the patient or not, you should check that, bring them back, and then you should do. So here what is happening, as we studied previously in the Samprapti, there is Kapha Avarodha. If you remember, because of the Kapha Avarodha, the Pitta is gone away from its Moolasthana. That is why this Kapha Avarodha has to be removed first. Then only you are making way for this dosha from Shaka to enter the Koshta. That is Srotamukha Vishodhana. Whichever is, which the Srotas has been blocked because of the vitiated Kapha, we need to eliminate the Kapha now. So for that, what are we planning? Tikshna Ushna Dravyas. Tikshna Ushna Dravyas are going to help us. We can use Pippali, Maricha, Shunti, etc. for that. After that, what can be done? After using all these things, we can also think of Amlarasa. Why Amlarasa? It is because it is Snigdha, Deepana, Vatanulomana and Kledana. And why do we need this? This second line of treatment is for the Vata. Vayoscha Nigrahat, what is told here. First is Srotomukha Vishodhana. For Srotomukha Vishodhana, we need Kafahara line of treatment and Tikshna and Ushna Dravyas like Pippali and Maricha. After that, our next intention is to do Vata Anulomana. So for Vata Anulomana, along with Deepana and Kledana, we can prefer Amlarasa Pradhana Dravyas. Then we can do the remaining protocol as per the Koshtashrita Kamala. Acharya Chakrapani has also told, Pittavardhana Chikitsa is to be continued till Mala gets its normal color. This is one important point which you must always think of in your practice. That is, for the removal of obstruction in Ruddapata Kamala, Tikshna Virechana is administered. That is a reference what we find. Tikshna Virechana. We never think about Tikshna Virechana in a Kamala patient, but they consider it to remove the obstruction. And for that, they prefer Danti, Trivrit, Katuki and Jayapala. Because they are Ushna, Tikshna, Lekhana and Katurasatmaka. That is why that is told as per Acharya Chakrapani telling the Pitta Vardhana Chikitsa to be considered till the Mala gets its normal color, because here the Mala is Tilapishta Sannipa. After that we can think, practically we can think of Yapanabasti, Kshiravasti, Anuvasanabasti, all those things can be done. Later all regular medicines like Arogyavardhini, etc. can be given. Then I think we can also discuss about some common medicinal practices that we have here, which I don't have it as a slide because it is just a discussion point where we will be talking about common medicated formulations what we use. Here in my regular practice, what we practice, that is the most pathya ahara or the pathya food I always prefer here is sugarcane juice, ikshurasa and draksha. These two are the things which is available as well as which is good here, and it is seen working wonderfully for the patients. And strictly no non-vegetarian food, no oily food, no alcohol intake. Such things are to be taken care of, and no madhura rasa pradhana ahara, because again we don't want to increase kapha. So no madhura rasa pradhana ahara has to be given. Then coming to the koshta, we need to analyze the koshta when it is about Kamala. We need to ask how often, what are the symptoms of his koshta, and then we need to for his internal medications also. For example, Krura koshta. A person with Krura koshta is coming. I would prefer Patola Muladi Kashaya before food. And this is to be followed only for 6 days. That would be sufficient. Patola is always for Pitta. Patola does the Shamana of Pitta. So Patola Muladi Kashaya is given in Krura koshta. Wherein for Madhyama koshta, I prefer Patola Katurohinyadi Kashaya. Patola is a constant here, but the remaining formulation, Patola Muladi Kashaya and Patola Katurohinyadi Kashaya, based on the koshta, we can give. And coming to Mrudu koshta, it is Vasa Guduchyadi Kashaya that we can give them. Vasa Guduchyadi Kashaya for a Mrudu koshta. This is to be followed for first 6 days, and then after 1 week, we'll change it to Drakshadi Kashaya. Irrespective of the koshta, we can give them Drakshadi Kashaya. Once the pitta is under control, we can give them Drakshadi Kashaya. That should be followed for a span of 14 days. After that, we can get them with the reports once again and then plan accordingly. Along with that, we have some medicines which I would say is serving good purpose, like Saptamrita Loha. Once again, here we need to also think of protecting Rakta. And that is the reason Loha formulations are always beneficial when it comes to Pitta and Rakta associated Dushti. So Saptamrita Loha is always advised to be taken 1 in the morning and 1 at night after food, and that with the combination or with the Anupana of Madhu as well as Gritha in unequal quantities. Both these things to be taken, 1 Saptamrita Loha tablet to be powdered and consumed. That is going to help. One more thing like this is Mandura Loha plus Shunti Churna. This can be mixed and had along with honey once or twice a day depending on the patient after food. Guduchi Swarasa can also be given to the patient. That also gives you good results. And Bhumi Amalaki Swarasa with raw milk, the milk which is not boiled, cow's milk, raw milk with Bhumi Amalaki Swarasa, morning 6 a.m. and evening 6 p.m. We have been practicing this for many years and the results have been very good. So we can also think of that. Fresh Bhumi Amalaki. Then coming to one more condition I would like to tell is, you may also find patients who are hepatitis B carriers. if you remember, we have hepatitis A, hepatitis B, etc. The patient hepatitis B carrier, that is for them, we usually don't get to know, I mean, they don't have any major symptoms or troubling them anytime. But this hepatitis B carrier condition is incurable. It is just preventive. We can't do anything for them, but we can only prevent them from further degeneration or damage of their liver. So, as a preventive measure, the best line of treatment or the best drug I prefer is Drakshadi Lehyam. Drakshadi Lehya, around 10 grams morning and night before food if taken. Anupana is Ushnajala. That is going to help in a wonderful way. Otherwise, Bhringara Churn. Bhringara Churn 10 gram with honey morning and night before food once again. That also is going to help. We usually prefer before food when it comes to the Pittaja Vikaras. That is the only reason for giving these things before food as far as what we are practicing. And I have a case report. There is a patient who's 28 years old. The history of him is he was a chronic alcoholic. He's just a 28-year-old boy. But he is an unemployed person. I mean, he's not going for work. He just stays at home. He drinks continuously, like from morning 8:30 he begins, and he told that he drinks rum and he drinks whiskey till he goes to bed at night, till 11 o'clock at night. So here, what is happening? This person who's drinking, and he has a proper fixed frequency for drinking as well. There, what is happening? He wakes up and he starts drinking at 8:30 with a gap of every 2 hours. 8:30, 10:30, 12:30, he goes on drinking. He is always drinking. And since he's not going for any work, he simply stays at home, drinks. And in every gap of these 2 hours, that is, he's drinking at 8:30 and he's drinking at 10:30. What is he doing in between? He smokes. He smokes in between. He stays at home. This is the only thing he would do all the time. And he came to me with a history of severe stomach pain. Yellowish discoloration was very, very severe in his eyes, but his body was not that evident. But his eyes were very, very yellowish in color, and he said his stools were very dark yellow in color. And then, as I told you, his stomach pain was always there in the right part of the abdomen, as well as it was radiating to his back. That was the history, he said. And I got him tested on 26th November 2022. 26th November, I was advised him the liver function test, and these are the readings. 168 was his AST, 189 was his ALT, and 669.4 was his alkaline phosphatase. That is, which is always supposed to be 100. His was 669.4. Then coming to his bilirubin, again, his total bilirubin was 6.75, which is actually supposed to be within 1 mg per dl. 6.09 was his direct bilirubin, which is always supposed to be less than 0.3. That is, for some people, we usually get it 0 also. That's not a problem. But his indirect bilirubin was normal. The other two things were extremely excess. Later, by December, I had prescribed him medications, I'll tell you. After that, he was not given Shodhana initially because he was not in a condition to take Shodhana. Nothing was getting digested. So, my intention was his whatever excess pitta is there, that has to be excreted from the body, and his koshta was Madhyama koshta. I planned for Patola Katurohinyadi Kashaya. So he took Patola Katurohinyadi Kashaya. He took only 15 ml. He didn't take 20 ml. He took 15 ml of Patola Katurohinyadi Kashaya and twice a day. That is morning. And my preference for Kashaya is always to maintain a 12-hour time gap so that the absorption as well as the action has given good results. This has been done based on a study. That is, my patients who are taking medicine at odd timings, that is, somebody takes it at morning 8 o'clock, night they'll take it 10 o'clock, or somebody takes it morning 7, night they forget, or night they take it at 10 o'clock. The result for them was lesser, but people who took it with a 12-hour time gap always showed excellent results, not just in Kamala, but in all other diseases when administering Kashaya especially. Asavarishta, I have not seen such difference, but in Kashaya, if a person is following that 12-hour time gap, the results have been tremendous. So here, what we say is, again, Patola Kadrohinyadi Kashaya, 15 ml with 45 ml of water was given to him. 15 ml plus 45 ml of water, boiled and cooled water, was given, and that has to be taken at 6 a.m. in the morning and 6 a.m. at night. 6 p.m. in the evening. These two times when he is taking, he had to take it for 6 days. Later, he was given Bhumi Amalaki Swarasa with raw milk. As I told you, Bhumi Amalaki Swarasa with raw milk and Drakshadi Kashayam. That is, once again, 15 ml plus 45 ml of water, morning 6 a.m. and evening 6 p.m. along with Bhumi Amalaki Swarasa for the next 15 days. For the next 15 days, I had told him that. And then in December, 18th December, he went for a blood test, and these are the results. His AST or SGOT, which was 168, reduced to 58, which is a wonderful result comparing to his values previously. His SGPT, ALT, which is 189, reduced to 60. And his alkaline phosphatase, which was 669, wonderfully reduced to 148.2. This is the result what we obtained, and then his yellowish discoloration was subsided to a good level, and then the remaining things, that is his total bilirubin from 6.75 got down to 1.10, serum direct bilirubin from 6.09 to 0.76, and indirect was normal before also, but it was 0.66, now it was 0.34. So after this, he has been advised with Virechana with Mahatiktaka Grita was given. Mahatiktaka Grita was given, and now he's doing well. So this is how Ayurveda can work wonders. You should always assess about the kosha of the patient and what type of Kamala the patient is suffering from. Once your interaction with the patient is going to be very good, and your knowledge in Samhitas to differentiate which is what would be more than sufficient for you all to become excellent clinicians, which is the best way to represent Ayurveda globally. So now, concluding this, Kamala is considered to be Pittananatmaja Vyadhi and Rakta Pradoshaja Vyadhi, where the skin, eye and mucous membrane takes yellow discoloration. In modern science, jaundice is considered as a symptom of liver disorder, whereas in Ayurveda, Kamala is considered as a disease. This is very true because jaundice is always a symptom. They say you may have liver cirrhosis, you may have some other injury to liver, damage to liver as per modern science. But Ayurveda is that science where Kamala itself is an independent disease for which separate line of treatment has been mentioned and more emphasis has been given. And then due to the dominance of Pitta in this, Mrudu Virechana and Pitta Shamaka treatment is given. This is the intention that Pitta and Rakta at the same time have to be protected, and that is why only Mrudu Virechana is given. I hope I could spare some amount of knowledge to all you youngsters. Once again, it was a wonderful privilege for me to have a session with you all, and on this auspicious day, I'm even more privileged. Thank you everyone for this wonderful opportunity and a lifetime experience. Thank you very much.
जी बहुत बहुत धन्यवाद डॉक्टर साहब, आपने इतनी नाइसली प्रोनाउंसिएशन के साथ पूरा प्रेजेंट किया है, तो मुझे इतना अच्छा लग रहा था। स्लाइड्स में भी आपने जान डाल दी है, जबकि आपके पास बहुत ज़्यादा कम समय रहा होगा, मैं समझ सकती हूँ, मगर आपकी विधा और ज्ञान के ऊपर जो कमांड थी वो काबिले तारीफ थी। मैं विश्व आयुर्वेद परिषद की ओर से आपकी बहुत बहुत हार्दिक धन्यवाद करती हूँ कि इमरजेंसी लेक्चर के रूप में आपने तुरंत ही अपनी कंसेंट दी, अनुमति दी और आप यहाँ पधारे और ज्ञान यज्ञ में आपने आहुति दी। और मैं समझती हूँ कि हम सभी पार्टिसिपेंट्स इसके माध्यम से बहुत अच्छा ज्ञान अर्जन किया है और ये YouTube के ऊपर भी मैं अपलोड करूंगी, तो वहां से भी आप बहुत सारे लोग इसको फिर से सुन के भी कुछ चिकित्सा की बातें लिख कर भी आप उसमें से अपना निहितार्थ, ऐसे जो अंदर से आप एक गूढ़ार्थ रहता है उसको भी आप निकाल के उसका फायदा, उससे बेनिफिट्स ले पाएंगे। डॉक्टर साहब थोड़े से क्वेश्चन ले ले।
जी
जी डॉक्टर साहब, एक क्वेश्चन आया है डॉक्टर प्रीति तोमर, हैप्पी धन्वंतरी जयंती टू ऑल। हैप्पी धन्वंतरी जयंती बेटा आपको भी। व्हाट शुड बी द लाइन ऑफ ट्रीटमेंट ऑफ द हेपेटाइटिस सी, काइंडली रिप्लाई। हेपेटाइटिस सी। डॉक्टर साहब आप चैट बॉक्स में भी देख सकते हैं।
जी, इसलिए मुझे मेरा नेटवर्क थोड़ा कनेक्शन कट हो रहा है।
अच्छा ठीक है, मैं आपको फिर से वो करके बताती हूँ। डॉक्टर प्रीति तोमर ने पूछा हुआ है, व्हाट शुड बी द लाइन ऑफ ट्रीटमेंट ऑफ हेपेटाइटिस सी, सी फॉर कैट।
जी, so usually what happens in hepatitis C, it is an infectious disease, so our immunity is damaged there, Dr. Preeti. So here what is happening, we need to strengthen the immunity of the patient there. That would be the first line of treatment, improving the immunity of the patient. Once again, Bhringraj and Bhumyamalaki, like any other thing, it protects the liver as well as our body's health. So Bhringraj Swarasa, Bhumyamalaki Swarasa, Bhringraj Churna. Along with that, we can also think of Haridra Khanda. Haridra Khanda is going to help the patient excellently.
जी, धन्यवाद डॉक्टर साहब। और कोई पार्टिसिपेंट्स अपना प्रश्न पूछना चाहते हैं तो अपना हाँ, एक मिनट। व्हाट कैन बी द निदानास ऑफ द मंदाग्नि ड्यू टू द पित्त प्रकोप।
Due to the Pitta Prakopa, Nidanas of Mandagni.
जी,
see, Mandagni and Pitta Prakopa, rather than that, I'll tell you the relation between Agni and Pitta. That will help you in understanding more. So here what is happening, Pitta has a set of gunas. That is, from beginning with the gunas, there is one guna called Drava Guna in Pitta. So what is happening when Pitta Vritti is occurring? This Drava Guna of Pitta is affecting the Agni. When water is poured into Agni, what is happening? The Agni is diminished. So Mandagni is nothing but diminished Agni, and that is happening due to the Dravaguna of Pitta. So any Pittakara Ahara Vihara will definitely lead to Mandagni always.
ओके, धन्यवाद डॉक्टर साहब। मुझे लगता है कि और कोई क्वेश्चन नहीं है। और आज धन्वंतरी दिवस के उपलक्ष्य में, धनतेरस के उपलक्ष्य में बहुत सारे पार्टिसिपेंट्स ने ज्वाइन किया है। मुझे एक बार याद था कि एक आयुर्वेद दिवस के उपलक्ष्य में चुलेट सर और मेरा बेटा और कुछ पड़ोसी इस तरीके से धन्वंतरी प्रादुर्भाव की कथानक को कहते हुए आदरणीय चुलेट सर ने सभी पार्टिसिपेंट्स को वहाँ जो आयुर्वेद से नहीं थे जैसे, मगर फिर भी हमने इस शुक्रवार को एक बार अपना विश्व आयुर्वेद परिषद की व्याख्यानमाला भी थी और साथ में हमारा जैसे नियमित क्रम रहता है कि हम ज्ञान गंगा में कुछ न कुछ अवगाहन करेंगे, कुछ प्रैक्टिस की बात करेंगे, कुछ शास्त्र में गूढ़ार्थ जो है उसकी बात करेंगे। तो ऐसा रहा था, मगर आज मैं समझ सकती हूँ कि फेस्टिवल है, बहुत सारे काम होंगे, दीप प्रज्वलन करना है। सभी पार्टिसिपेंट से एक आग्रह करना चाहूंगी कि आज धन्वंतरी भगवान के नाम का एक दिया जरूर आप सभी प्रज्वलित करें। और आज के व्याख्यान में सभी उपस्थित होने के लिए डॉक्टर ईशा पवार, डॉक्टर चंद्रकला जी, डॉक्टर प्रीति तोमर, डॉक्टर किमाया और भी सभी का मैं बहुत बहुत हार्दिक धन्यवाद करती हूँ। डॉक्टर भुवनेश जी, आपका भी हार्दिक धन्यवाद। आप हमारे एक इमरजेंसी स्पीकर के रूप में हैं। डॉक्टर बबीता और डॉक्टर सौम्या विजय, सभी का बहुत बहुत धन्यवाद कि आज त्योहार, आयुर्वेद दिवस, धनतेरस और काफी हमारा बिजी शेड्यूल रहता है उत्सव के दिनों में, उसके बावजूद भी डॉक्टर स्वाति त्यागी, सभी का बहुत बहुत धन्यवाद कि आप यहाँ आए। और विशेष धन्यवाद इमरजेंसी स्पीकर के रूप में, क्योंकि हमेशा 2-3 महीने में डॉक्टर अपर्णा जी एक बार इमरजेंसी हो जाती है कि कहीं ना कहीं किसी स्पीकर के साथ कहीं कुछ काम में व्यस्तता आ जाती है, और आप यहाँ हमारे निवेदन पर तुरंत ही पधारे और इतना अच्छा हमारा ज्ञानवर्धन किया। तो मैं आपका विश्व आयुर्वेद परिषद की ओर से तहे दिल से आपका धन्यवाद करती हूँ। सबसे अंत में मैं शांति मंत्र बोलूंगी, आप सब म्यूट रखकर ही दोहराएंगे। ॐ सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्। ॐ शान्तिः शान्तिः शान्तिः। नमो नमः। सभी का बहुत बहुत धन्यवाद। विश्व मंगल की कामना के साथ अगले लेक्चर में हम 425वें लेक्चर में फिर से उपस्थित होंगे एक नए स्पीकर के साथ और नई ऊर्जा के साथ, नए उमंग के साथ। फिर से आयुर्वेद को भारत की राष्ट्रीय चिकित्सा पद्धति घोषित करवाने तक हम अथक प्रयत्न करते रहेंगे और आप सभी का उसमें मुझे साथ चाहिए। बहुत बहुत धन्यवाद। नमो नमः।